do you guys know what the target is that's being attacked in lupus is? Does anyone know what the actual target, some of the targets, common targets are? Think about this. One of the tests to diagnose lupus besides ANA is anti-double-stranded DNA. What if you have an autoimmune disease and your immune system likes to attack DNA? Where in your body do you have DNA? That's genetic material. Okay. Literally every cell in your body has DNA. Okay. So this is why lupus is actually called the great mimicker. The great mimicker. You know why? Because it is almost as if you're going whack-a-mole. You have symptoms everywhere. It can attack the skin. It can attack joints. You can have chronic fatigue, depression. It can affect the kidney. I mean, you name it. When I deal with people with lupus, no two lupus people are the same. And the reason is because we have DNA all over our bodies. And depending on which part of the DNA your particular immune system likes to attack, it's going to be different on Wanda than it is going to be on Jade. And it's going to be different on me, for example. So, but lupus is one of those that's going to be really important for you guys to understand. Autoimmune is attacking a lot of things. It's not just about one target. And lupus is the case where the target is DNA, which is in everything. So doesn't it make sense then that doesn't it make sense then that we start looking at how do we calm the immune system? How do we deal with what's the root cause of this problem? What is fueling this immune system to misidentify and attack so many things? That is the core problem in MIST and the core problem with autoimmunity. And lupus is a really great example of that. And it's really not uncommon for me with lupus patients to also experience a lot of central nervous effects like vertigo, tinnitus being in the ears, Raynaud's syndrome, which is like it affects the blood vessels in the fingers so it turns pale. And how many of you now are sitting here thinking like, oh, yeah. And here's the problem. Do you know how many people have been told, only one test is positive, but the other's not positive? You don't have lupus. So in the meantime, you're going to be on hold waiting. What are you waiting for? Your kidneys start to fail, right? Depression for 6 months, so you can't work. Some final test to turn positive that would never turn positive because you didn't fit that one type of lupus, right? That's a really diagnostic problem. And here's the thing. 90% of people with lupus are women. Women, right? So how big of a problem is this how big of a problem is autoimmunity for not just lupus, but anybody with any autoimmune disorder, with lupus showing you all the different places this can impact?
So a couple of things as far as that goes, like this really, what you were saying really shows the problem with our healthcare system in the sense that there is always this idea of you're not quite sick enough. It's a wait and see.
Yeah.
We're, we don't really have the test, so I can't give you, or the test came back negative, so I can't really give you anything for this because my doctor training says if you're test negative for this, then this doesn't happen. Yeah. And it's like this checklist, right?
Yeah.
If you don't fall squarely into the checklist, then whatever's wrong with you is irrelevant. Well, it doesn't fit in nicely and neatly into a box.
The vast majority of people that we see that we deal with have tons of different target symptoms, and they literally feel like they're chicken with their head off. And they're advocating and driving their own healthcare through a parade of specialists, charade of specialists who are just like, oh, you don't have MS because that workup is negative. Well, what about my joint pain? What about my, Raynaud's? What about my thyroid? That's not connected, but you don't have MS. Let's scoot you to the next specialist, to the next specialist, to the next specialist. We're taking autoimmune disease and we're saying, well, we're going to take that one target we could identify if you're one of those lucky individuals, and we'll send you to that specialist. What does a neurologist for MS, which is one of the most common autoimmune diagnoses, know about hormones, about joints, about digestion, about histamines, right? About POTS? Nothing, right? But yet those are the other targets and those are the other symptoms that are happening. So we're not really serving people with some of these really common diagnoses by sending them off to the rheumatologist, Crohn's, sending them to a gastroenterologist, and even MS, sending them to a neurologist. That doesn't really solve the problem because they don't have a big picture approach to this. Look, I can't help you by you watching this training, right? But what I can do to help you is I need to ask all these questions about all these systems. And I created a 360 health evaluation where when you go through it and you answer all these questions, it gives us a really good idea of what systems are under attack. So if nobody's really sitting here asking all these questions about these different symptoms and then generating a report and an evaluation and going it over with you, how the heck do you know it's connected when none of your doctors really understand that this is a syndrome, right? So if you are interested in doing the 360 health assessment and going through the evaluation and having us review the results with you, we're going to put a link in chat for you to do that.